Pyrocarbon is a relatively new option for shoulder arthritis, and it is a graphite substrate. So pyrocarbon is the same density as bone, and when we place a pyrocarbon ball instead of a metal ball, it doesn't wear through the socket. When we used to do metal ball replacements, that heavy metal against the patient's own socket would erode through the socket, and that would cause terrible problems. But putting a socket component in a young patient who's active would cause the socket component to loosen and cause terrible problems. So pyrocarbon now is a material that we can use that will relieve your arthritis pain, but it will not wear through the socket. So it lets you be active, do anything you want. We even allow powerlifting. Initially, when it was released, we were thinking it's just for our young patients with arthritis. But we realized age is really just a state of mind. So we have plenty of very active patients in their 50s that don't want to have restrictions and want to be able to go to the gym, do heavy lifting, and do whatever activities they want to without fear of wearing out a socket component. And so we are starting to see that pyrocarbon as a form of a shoulder replacement for even older patients that wish to remain active. If they're the right candidate, there's a couple characteristics about the type of arthritis you have, but if you're the right candidate, actually pyrocarbon is being used in the United States in much older and older patients, and we're really looking at your physiologic age more than your actual age.